Hi, my name is Gabriela Contreras, and today I'll be presenting subdural hematomas. Here we have a table of contents, what our presentation will consist of, and there's definition, signs and symptoms, causes, occupational performance deficits, and ending with OT assessment tools. So now, what is a subdural hematoma? It is when blood vessels within the brain tear, which can cause blood to accumulate between the brain and its protective tissue, or the outer layer, called the dura mater. The excessive amount of blood will slowly expand the subdural space of the brain, leading to possible herniation of the cerebral structures and displacing those protective brain tissues. Symptoms. So there is a variety of symptoms that can be present, and this also depends on the particular level that an individual might have. For instance, acute. Acute is the more severe level aspect of these hematomas, and it's usually symptoms are presented within minutes to hours. The subacute level is within days to weeks. So this is mainly seen with concussions, and the chronic level is seen weeks to months. And these are usually seen by older adults that are 65 plus that either fall and don't remember, or something like lung disease that they see more present down the road. But overall, there's chronic headache, nausea and vomiting, slurred speech, dizziness, changes in vision, balance difficulties, and weakness on one side of the body. In those severe cases, or the acute cases, there's usually memory loss, unconsciousness, disorientation, and at times personality changes. Causes. So the main cause of these hematomas are due to head injuries, either if they are accidental or intentional. Some risk factors are brain shrinking, blood thinning medication, and age. So for instance, babies usually present with these type of hematomas due to shaken baby syndrome, and older adults that are 65 plus, like mentioned before, it is either due to falls or because of those possible diseases that they already may have, like let's say lung disease, like mentioned prior as well. Another risk factor is athletes. So these individuals who obviously play sports and they are very physical. There's times, obviously, head injuries are going to happen, so it's very common to see within athletes as well. Next, we have occupational performance deficits. So because weakness is present, balance, vision, coordination, and memory are affected by these hematomas, it is obviously going to be a bit difficult for these individuals to complete certain aspects in their everyday life. For instance, basic ADLs like feeding, dressing, bathing, and self-care would be a tad difficult for them, depending on obviously the level of their hematomas and the side effects that they got from it. Some physical deficits that we may see is obviously balance, like we said, strength, motor coordination, loss of sensation, and vision difficulties. In severe cases, cognition is a huge one, as well as overall just memory loss. OT assessment tools. So there's various tools that we can use in cases of subdural hematomas. So we have non-standardized assessments. So these can be interviews with the patient and the families, observations, and some screenings. We also have manual muscle testing due to the weakness that they present, visual motor and visual perception. The Glasgow Coma Scale is usually for the orientation and cognition of these patients. So this is usually due if they do lose consciousness and stuff like that, if in those severe cases. There's also the COPM, or the Canadian Occupational Performance Measure, and this is usually to prioritize those weaknesses that they have. Last, we have the Functional Independence Measure, or the FIM. This is functional capability measures, and to see those specific levels of assistance that these particular patients may have. This completes our presentation. Thank you very much.